Good morning, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System, bringing you today on Monday. I believe it's, oh, wait, just a second, wrong day. Monday, November 9, the 71st edition of the COVID-19 community briefing. For those of you that saw Friday's briefing, this is not the undisclosed location that I was referring to when I mentioned that there would be no briefings this week. As we all know, there are no certainties in 2020 and no expected results. On Friday, I went in for a precautionary COVID test because I was heading off on an elk hunt and I did not want to infect the camp and to make sure things were okay. And unfortunately, I was positive on Friday, asymptomatic, positive, and so here I am today in a not disclosed, or I guess a disclosed location being my home, where I will be for the next 10 days in isolation. With all the precautions that I've took, with all the mask wearing, on all those things, it still happens. It still happens. So we really implore you to continue to do all these things. And again, we're not bulletproof when we do them, but we do reduce the odds. I'm feeling fine, largely, and I feel very blessed to feel as good as I do. And so that's why we're having the briefing today. And that's why I'm here. So because it is a Monday, we're going to start with the local scoreboard. And the numbers are, to use a word, exploding is not too strong a word. Numbers all over the state are up significantly. And in Orange City, it is no different. We had a positivity last week locally of 56.7%. You heard that right, 56.7% of our cases that we tested last week were positive. We've had 1,075 positives now out of 6,022 tests that we've done locally here in Orange City. That is a 17.85% positivity rate. And previously we're at 17%. Sioux County is exhibiting the same kind of things. 2,926 positives, so almost 3,000 positives now, of the 10,443 tested. That is a 28.0% positivity rate. Previously, we're at 27.5. That was 116 new positives since Friday. The 14-day average is not any better, and all over the state is significantly higher. Number one in the state, by the way, is Jones County at 42.7% 14-day positivity rate. Number one, Jones, 42.7. Number two is Wayne County that we mentioned last week. I believe that's in the very southern part of Iowa, 40.2%. So number one and number two are over 40% in the state. Sioux County is very high at 28%. That gives us a number 8 ranking. Previously we were 27.2, 23.3, and 20.4. Plymouth County is number 6 in the state at 29.8%. Previously they were at 26.3, 23.3, and 20.7. O'Brien County, number 12 at 25.9%. They were 26.8, 25.7, 23.2. Lyon County, number 18 at 23.8%. Previously 21.1, 18.7, and 17.5. There are now 98 counties out of the 99 in Iowa that are 10% or higher. And I've used the 10%. Actually, in this case, it's 11.5% or higher. The 98th county in the state was 11.5%. So significant outbreak all over the state. And again, it was just on October 19 that there were only 44 counties in the state of Iowa at 10% or higher. So significant increase no matter how you measure it. Region 3, the 20 counties in Northwest Iowa, Region 3 in Iowa, there are currently 167 hospitalizations. Those numbers previously were 148, 139, 124, and 112. Staircase kind of increase in that also. Fortunately, that is not replicated in the ICU, although the ICU beds are up in terms of 26. Those numbers previously were 25, 20, 20, and 20. So not a lot of change there in the ICU side, but significant increase in the hospitalization side. Of the 26 ICU patients, 11 of those are on ventilators. There have been 26 admits in the last 24 hours as well. Moving to the state of Iowa, there's 156,814 positives. That's over 15,000 more positives since Friday. Over 15,000 since Friday. We've now done 1,040,916 tests. That's a 15.1% positivity rate in the state, up from 14.1. So on a million test base, we've climbed 1 percentage point in just a week. Well, actually just since Friday. So that's significant by any measure. Hospitalizations, we now have 992 Iowans hospitalized with COVID-19, and that includes 64 patients that are hospitalized out of state. That is up 215 since Friday. Sioux County has 13 residents hospitalized somewhere. O'Brien County 3, Plymouth County 6, Lyon County 1. Those numbers are not dramatically different than what we've been experiencing over the last week or so. Reasonably consistent there. Woodbury County, 41. They were 40 on Friday, so relatively steady there. Polk County is number 1 in the state at 85. And they are 71 as of Friday and 57 a week ago. So they've gone from 57 to 85 in 1 week's period of time. Sioux County at 13 residents hospitalized is somewhere in the area of 18th in the state. I counted 17 counties higher in the state, and that doesn't take into consideration population, but it just takes in gross number of hospitalizations. 17 counties in the state higher than Sioux County. We have had 42 additional deaths since Friday. 1,845 is the number. Sioux County remains at 20. The demographic now is 89% at 61 and over. So that is kind of a rundown of the stats. It's by far the worst statistical report that I've had to give you. These numbers are significantly up. And you know, if you believe in the multiplier effect, the virus needs to be running out of people in Sioux County pretty soon to infect. Because at almost 3,000 positives, you could reasonably expect that 25 to 30,000 people in the county have had or have the virus right now. But we're in the thick of it, and so is Iowa, and so are other states. A little bit of an update regarding some local things here. The nursing home, we're very blessed that last week again, we tested 0 residents as positive. We tested all residents every week. Again, last week was 0. Very, very blessed with that, and kudos to our staff for being able to discipline themselves and in a very tough environment psychologically. But it's really important in that area. So very fortunate there. At Landsmere Ridge, we have had an additional death from a COVID-related situation. And so that's very unfortunate. But we have no positives at Landsmere Ridge currently. On the inpatient side of things, Saturday was crazy here at the hospital. Yesterday it was a little bit better. As of this morning, we have in the neighborhood of 21 patients in the hospital. 11 of those patients are COVID. We have the ability to room 13 COVID patients in a negative pressure environment. So we're doing fine there from a facility standpoint. Again, negative pressure is something beyond what we are required to do, but it's something that we're very blessed to have within our facilities. That's where all the air is vented outside from each of those rooms. Staffing is holding up reasonably well, but there's no question that it's strained. And obviously you think about the frontline workers as nurses and physicians, and truly that is the case, and they are growing weary, there's no question. But also our environmental services staff, the people that disinfect the rooms, that take care of folks, that support the people who support the caring for people. And so if you know somebody, thank them, pat them on the back a little bit in their role. I'm personally very grateful for the effort and the resolve and the resoluteness that I see in the eyes of our caregivers. And so we're doing all right, but we still ask you to do your part in masking, avoiding groups. The best thing now is to avoid groups. Keep your hand hygiene going, and just do what you can to keep this thing. We got to ride it out a little bit longer. Now this morning, speaking of riding it out, I did hear on television, and so you can take that for what it's worth. But Pfizer announced this morning a vaccine that was 90% effective. Don't know if that's legit. It sounds too good to be true. Everything that I heard before talked more like 50% effectiveness, but this morning was 90% effectiveness, and as early as later this month availability. Don't know if that's true, but the stock markets were reacting accordingly. So, that would be very welcome at this point, of course, but we're not holding our breath either. In terms of that, we've done all the paperwork that we need to do to be in line and be engaged. When the vaccine does come out, there's a very specific way that this will be distributed, and it'll be coordinated through community health partners. We have all of that paperwork lined up, ready to go. So we'll be at the front of the line, so to speak. And my understanding is that perhaps senior care folks will be the first folks to do that, and that can't happen too soon. So again, I wish I was not with you today. I wish I was out on a horse looking for elk, but the Lord had other plans. And so I will plan on another briefing later this week, and then we'll see what the week brings. So in the meantime, we ask you to stay vigilant, stay strong, and above all else, stay healthy. Thank you for joining us today. Look for another briefing later on this week. Thanks again.